Dr. Tom Roselle live right now, 630 WMAL.
This is a recording of Dr. Tom Roselle live for Sunday, March 13, 2011. You can listen to Dr. Tom Roselle live every Sunday from noon to 1 p.m. right here on 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio, 888-630-9625. That's 888-630-WMAL. That's how you get a hold of me. That's how we talk about your problems that you've tried, you've applied, and come up with a whole lot of nothing regular to your medications and other things that you've tried. Well, this is the natural approach. This is how we do it without drugs and surgery. Give me a call today, 888-630-WMAL, and let's talk about what you want to talk about. We're going to have some very interesting topics. We're going to talk about the rest of the story when it comes to vitamin D today. We're going to talk about a very common food that's available to all of you that can dramatically decrease your risk of cancer, and not only decrease your risk, but also reverse it in many situations. There's a lot of things you really need to know about that so many of us don't know, and it's really at your fingertips. You are where you are at this moment in time because of the decisions and the choices that you've made up until now. Wouldn't it be nice to be able to take control? And in the era of Obamacare and national health care insurance, guess what? You are in the driver's seat. You have to make a decision today to reverse your health wellness index. To fail to do that, to change, is only up to you. 888-630-9625. Want to tell you something very interesting, and I think I'm going to springboard it from a place of some questions that people have been asking me now for, and I don't know why, ongoingly, but the last couple of weeks, I probably have had a dozen patients ask me, do I need a multiple vitamin? And this is, our normal treatment pattern. We're going to prescribe and we're going to add things to patients' dietary patterns, but do I need a multiple vitamin? And there's a lot of people who say that everybody needs a multiple vitamin every day. And many of you take all kinds of multiple vitamins, and I'm here to tell you that unfortunately a lot of the stuff that you take is nothing but unadulterated junk. It's garbage. They're petroleum-based vitamins or synthetics in many different ways. And unfortunately, you're not doing yourself a whole lot of good. And we need to explore that. We need to talk about what really the experts are saying about multiple vitamins. And most of them are saying, you really need supplementation because your food, your water, the air that you breathe, the surroundings are not only not giving you what you need, but they're depleting you dramatically, so you've got to get something in. Food isn't what it used to be. Years ago, you used to say that if you ate spinach, you can get enough iron. Well, in the 50s, there was about 20 times as much iron in a can of spinach, a bag of spinach, your spinach that was on your plate, than what you have today. Popeye would not be able to get those muscles with a can of spinach and go save olive oil. Well, guess what? We have to make some changes. We're doing it to ourselves. Our soils that we grow the nutrients in, the GMO-modified foods that we're getting are taking everything out of us. The most effective way to lower your healthcare costs and avoid getting sick is to make sure that you have a well-balanced diet and you get exercise and you get the rest that you need, but also supplying essential vitamins and minerals that you're not getting from any other source. Very few people eat right today. How many of you really sit down and eat well? You know that you're getting 0.7 grams of protein per pound of body weight that you want to maintain. How many of you are exercising? How many of you are drinking the amount of water, clean water, alkaline water that you should be getting every day? How many of you are making sure that you're getting a mixture of fresh vegetables and slightly steamed or stir-fried quick vegetables, but you're getting about 7 servings a day? A serving is 1/2 cup. How many of you are making sure that you're staying away from refined foods and sugars and fried foods and glutens and all of those things? Not too many of you. Well, when it comes down to the basics, that says, well, the majority of us really need to have some supplementation. And we're not talking about the minimum daily requirements, because that takes into consideration somebody who's about 154 pounds, sitting at rest, doing nothing all day long. But based on dietary guidelines for Americans and adults, there are huge deficiencies in all kinds of things, including calcium and magnesium and vitamin A and C and E, and the list goes on. But, of course, taking a multiple vitamin doesn't include many of the other health-promoting nutrients that you need. So you have to be very, very careful where you get it and how you put it together. There was an interesting study out of Harvard School of Medicine. It was going back to actually 2002, and it was published in the Journal of American Medical Association. Figure that, right? The authors reviewed 35 years of research on vitamins and chronic disease and concluded that every adult should take a multiple vitamin as a safe and inexpensive way to optimize their health. Now, this goes back to 2002. Go figure. And how many physicians out there say, well, you don't need anything. You don't need any vitamins. Food doesn't really have much to do with anything. You get what you need. Your body just kind of assimilates everything it needs to get. Well, maybe, but not so much. Everybody's nutritional needs are different. Mine are different than yours. My activity level is different than many of yours. Some of you, have such intense pressure in your life that you're burning up all kinds of minerals and vitamin B and so forth, and you're not getting them restored from anywhere else. Nutrient requirements vary greatly depending on the individual and so many different factors: hereditary, physical activity, body size, gender, climate, aging, illness, the medications they're taking, because you get rid of so much nutrient base just by taking the wrong stuff. Different types of environmental factors. Where do you live? The pollutions that are around you. How about the lifestyle? Tobacco, alcohol use, and so forth. How about intestinal parasites? You ever think about that? You're feeding two of you. 60% of the population has parasitic infection. 60% has some sort of parasitic infection. That means more than 1 out of 2 of you. And much of that stuff is transferable. So we're depleting our bodies. So the nutrition industry has not yet created a multiple vitamin for every specific condition that may affect nutritional depletions and needs. It's best to start with something that is well balanced. It should be organic. It should be something that interacts easily within the system. It shouldn't be something that goes to such excesses that it creates depletions and demands for other nutrients that it doesn't supply. But there are specific differences between male and female systems, and we're going to talk about that a little bit. So understand that if you're going through a rehabilitative process, that if you're sick, you're not feeling well, you're under a lot of stress, you're not eating the way that you should, you're overweight, you're overfat, you're underweight, you don't have as much muscle mass as you should, there's a balance there, and it has to be recognized, and you have to be able to put it into the right context to get what you need. We're here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. We've got some interesting things that I'm going to share with you today. So let's talk about ladies, because ladies always come first, right? So women are greater risk than you guys are for things like osteoporosis, and subsequently they need a whole lot more to maintain mass. But it's not just as simple as taking a multiple vitamin. We have to make sure that they're getting enough calcium and magnesium and they're at adequate levels. But even with that, the absorption is what we're talking about. Absorption is important. If you're getting something from Costco, I can promise you your absorption level is way low as it compares to taking a multiple vitamin from a manufacturer like Thorne or Perk, which is far more biologically available to your body. So you need to have approximately 500 milligrams of calcium, ladies, 200 milligrams of magnesium. Then you have to put vitamin D. There should be some biotin involved in it. Again, it's individualistic. Vitamin K is a substance that we have to have. It was once recognized as just a clotting substance, and now we know that it's linked to bone and cardiovascular health, and it should be in there, and not at high levels, but it aids in the absorption of calcium within the body and makes sure that we don't clog our arterial system and ending up with something called calcific plaquing, which is not a good thing. Nothing gets through at that point. It's like concrete within your system. So we go on and we look at basics. We know that we have to have silica in a multiple vitamin. We know we have to have something called ipritflavone, which is a synthetic version of the isoflavone found in soy. Not good. Soy is better. Yes, soy is good for you. It's not necessarily something that you're going to worry about causing you cancer if it is not a GMO source, genetically modified substance. Women, you lose iron. You lose it from your childbearing years, from the time you start your menstrual cycles, and depletion goes on over time. Inorganic forms of iron have very, very low absorption ability in the body and typically produce very nasty side effects, and some of them are like nausea. You want to throw up. It's not a good thing. They just don't get into your system, and they don't transport the oxygen that you need in your body, so you always feel tired and depleted and worn out and so forth. So there's hormone support you need. There's a lot of herbs out there, from your isoflavones to your things like wild yam and chaseberry and donquai, but in low levels if you know that you're going through those stages of transition, which are, from a very young woman into a stage of a woman, and then going in from perimenopause into menopause and so forth, and they need to be balanced. So you have to look to good manufacturers, good folks that are out there. Guys, guess what? I didn't forget about you. You have to make sure that you have basics. You have to have high levels of zinc. The dry weight of the prostate is 50% zinc. The dry weight of the prostate is 50% zinc. So as we get older, under stress conditions, we burn zinc out. It kind of goes. And, zinc is necessary for sperm formation, testosterone formation, and so forth. If we don't get it, we got a problem. We end up with benign hypertrophy, enlargement of the prostate gland. You also have to have things like saw palmetto. You also have to have something called lycopene, which, if you are Italian like me, you love tomatoes and you eat them cooked, and you have lots of lycopene. But the balance is you don't need as much calcium as women. You need sometimes much more magnesium. You need a lot of vitamin B. Vitamin C for both of us. Anytime that we cook our vegetables, anytime we cook our fruit, vitamin C in most situations is depleted because it is heat liable, which means that it is destroyed once it's exposed to heat. So you have to look for differences. One size doesn't fit all. You have to make sure that it's organic. You have to make sure that it's a basic vitamin. You don't want to take excesses of things because they deplete other things. You have to look at your stress environments. You have to look at what your exposures are. You have to look at what your physical terrain looks like, your body itself. Once you do that, then you can get some help. Go talk to somebody and find out what fits you. What fits you, and make sure you begin to make the changes. Remember, it starts from structural, chemical, emotional. You have to make sure that you exercise. You have to make sure that you eat well. You have to make sure that you vent the stresses. That's the beginning place. That's how you do all of that. Want to remind you that coming up in September is Ageless Health 2011. Go to our website, rosellecare.com. That's ROSELLECARE.com. Those of you who have been know that it's a sold-out event, always. And we don't want to leave you in the dark, but right now is the time to really put it on your calendar, because we're going to be advertising very soon, and it's going to fill up very, very quickly. RoselleCare.com, and if you can't do it that way, call us at 703-698-7117 and let us know that you need some information, and we will send it to you. But that'll be this September. Don't be last, because unfortunately you will be last and you'll be left out.